We are live in Nakawa, where you do have the Aga Khan University Hospital being launched. Today is a big day, and I'm honored to be standing next to Diana Sewandana here, who is one of the people behind the works that are happening, the launch that we're seeing today, but also the future of healthcare in Uganda through the Aga Khan University Hospitals. Now, she serves as the Senior Manager Business Development and Operations, and this is for the Aga Khan Hospitals, Uganda specifically. Diana, it's been a long day in waiting. Tell us more about today and what we are intending to launch, especially for the side of the Aga Khan Hospital.
Very interesting things are happening. We are definitely delighted and excited to see this day come to pass. Like you said, clearly it's been long awaited, and indeed we have prayed for it. So for us, this is a prayer coming to pass. Yeah. It is an answered prayer for us as Ugandans, for us as a country. And exactly what is happening here tomorrow is that we will be witnessing the inaugural ceremony for the academic facilities, as well as the groundbreaking for the construction of the Aga Khan University Hospital in Kampala.
Okay. All right. I know that you've been doing some behind-the-scenes work, holding and conducting clinics, so as to create awareness within the different communities. Talk to us about these communities and what have you realized the impact the hospital could have in the near future?
So yes, we have been in existence for more than a decade. And in Uganda, we have been running what we call outreach facilities, outreach clinics, where we've been primarily offering primary health care and a bit of secondary health care. And now, last year, actually, we launched our very first facility on this campus, which is a 60-acre campus in Nakawa. So we did our first launch for our first operational facility, which is the Nakawa Specialty Center. And in this particular center, for the very first time in our operations in Uganda, we made a step into tertiary health care, where we started the services of, say, chemotherapy, hemodialysis. We brought in advanced medical imaging services that includes the CT scans, mammography with tomosynthesis for the very first time in Uganda. And then we also brought in other services like neurophysiology, which were very highly sought after by Ugandans outside our country. So when we did our launch last year in April, we saw quite a number of Ugandans coming in to take up the services. And even with that very little start, we were able to see a number of patients that were leaving Uganda for healthcare abroad, coming to take up the services that we have brought closer to our country.
Okay, Diana, let's talk about health tourism. Aga Khan Nairobi has been the song for many Uganda, our top government officials, the rich also crying and going to Aga Khan Hospital, Nairobi. And of course, I know that you have also one in Tanzania. And so there's been a migration of health facilities because they are saying they have been offering the best healthcare within East Africa. Now that we have our own campus here in Uganda, in Kampala, what does that mean? How is it going to reverse this medical tourism that we've been seeing in the region?
It means a lot to us as Ugandans, because it is true, like you have clearly said, we have been seeing many Ugandans on a daily basis, on a weekly basis, leaving Uganda to go for healthcare abroad. And what it means for Ugandans to live here and go for healthcare abroad is not just boarding a plane and go. The cost of healthcare out of Uganda is very expensive. It is not only expensive in terms of care, but it is also expensive in terms of the stress and the strain that our people have to go through the different checkpoints in airports. So what we intend to do as we launch the construction of the facility in Uganda, we seek and we intend to curb that medical tourism that has not only been draining resources from Uganda to hospitals abroad, like in India, Kenya, all over the world. We will not only curb that, but we will also ensure that we curb the brain drain, because we do not only lose patients, but we also lose specialists.
Let's talk about the brain drain, because you hear our, family members going to the Aga Khan Hospital in Nairobi and say, hey, Dr. Gwal is there. Hey, remember Dr. Sebagala? I found him there. How are we now, with the setup here of the Aga Khan Hospital here in Kampala, is there a potential of then retaining some of this brain drain that has been transferred to the
It is one of our biggest successes that we have not even tapped into fully.
Exactly.
What we have already seen is that we have seen doctors,
Yeah.
specialists abroad. They're Ugandans who were born and raised here. Some of them studied abroad, but we have seen them talk about coming back home. They keep calling us and say, are you ready? Should we come? When can we come? Doctors from all over the globe, from Kenya, from Tanzania, from South Africa, from Canada, Cambodia. Recently, I got a call from somebody in Namibia. They're all saying, we want to come back home. Are you ready? Should we come?
Uganda.
Gamuna Uganda. Bana Uganda, bakulidde wano bagezi. Abana Uganda bagezi. Era tulabye amawanga mangi aga benefitinze ku bugezi bw'abana Uganda abasomesezebwa Makerere.
All right. Let's talk about the relationship that is going to be between the Aga Khan University and the Aga Khan Hospital in terms of retaining our very own, brain experts and specialized doctors.
So essentially, the Aga Khan University is a training institution. And as you have already seen, we have a couple of students even on campus already. So the future of the Aga Khan University is to train not only the nurses, but we'll also expand into a medical college as the hospital develops. So once we are able to develop our own human resources in Uganda, just like other institutions are already doing, we'll be able to add on to the existing human capital in the country. Once we have our doctors trained, our nurses trained, our specialists trained here, we will be able to retain them even in our hospitals, not only Aga Khan, but we'll also supply the other hospitals that are in dire need of the specialists, of the nurses and the doctors.
Okay.
Yeah.
In that very same regard, how do you then intend, as the university hospital, how do you intend to also attract, you've talked about your friends from Cambodia and Namibia giving you calls and asking you, are you ready? And so it begs the question, what strategic directions do you have in attracting foreign experts, foreign specialist doctors, so they can also come and offer their services here?
Building a facility or an infrastructure that meets world-class standards, that delivers the quality that people leave the country to look for. That is the game changer. As long as we have the infrastructure, as long as we have the facilities, as long as we have the equipment, we do have the patients. What we need are the facilities and the human capital. Once we have that, we have them come back home.
Okay. We've talked about specialized doctors and then also specialized equipment. What specialized medical facilities or what specialized medical care are you going to be offering here at the university hospital?
Predominantly tertiary healthcare. Obviously, we'll start with the primary healthcare, we will go into secondary healthcare, and we'll ultimately end with tertiary healthcare, because the people that leave Uganda to go seeking healthcare, they don't go looking for primary healthcare, they don't go looking for secondary healthcare, they go looking for tertiary care. That includes cancer care. That includes cardiology services. That includes nephrology. We have seen people going into hematology. So those are the areas that we want to build on. We have partners already in Uganda that have already done that. Partners like Mulago, they are already doing many of these things, but we want to add onto whatever is existing so that we can serve as many Ugandans as possible.
Okay. On that note, having been opened last year, we beg the question, what is the 10-year strategy as far as the Kampala campus is concerned in contributing to better healthcare in Uganda?
10-year strategy, as you can see tomorrow, we will be doing the groundbreaking, so that marks the beginning of our construction for our hospital, which will begin with phase 1. Phase 1 will constitute 101 beds, and then of course we will be offering tertiary care, we'll be doing cardiology, we'll be doing oncology, we'll be stepping into the areas, especially the non-communicable diseases. So as the demand increases, as the need increases, as we keep developing, because even Rome was not built in one day, it wasn't built in one day. So we will build until a level where not one Ugandan will have to leave the country.
Okay. All right. The other problem, Diana, we have faced is that all these specialized hospitals are in central Uganda, Kampala to be exact. When you look at the references that are being made to, the different other regions, people are crying. People have to get in 2 buses cancer patients have to get on 2 buses to come to Mulago to get the specialized care. You have those facilities here for cancer. They would have to get on 2 buses all the way from Koboko, Nakapiripit to get here, all the way from Lukunjiri Kabari to get here, to mention other places. And so it begs the question, futuristically speaking, I know that currently it's not operational, but as an operations manager, futuristically speaking, are you intending to extend these services closer to the rural communities and the broader Uganda?
Yes, we definitely have the vision to expand and reach out to as many districts as possible. You have already seen us do outpatient facilities, different clinics in different locations. That will continue. We will expand on those so that we can reach out even to the remotest areas of Uganda. However, we are also blessed as a nation. We have a government that is visionary. What we have already seen in the last couple of years, the infrastructure, especially in terms of road construction. Roads in Uganda are getting better and better by the day. There's a lot that is going on to improve road access. You have seen we already have the Ginger Expressway that is in plan. So we believe that once all these road works are done, which are already in progress, by the way, very beautiful roads that have been constructed, those will facilitate the patients that are coming from far. Right now, even before all that is done, we are getting patients from Burundi. What is Gulu? We are getting patients from Ethiopia. We are getting patients from Namibia. We are getting patients from South Sudan, all the way because of the good road infrastructure.
Okay. All right. Still staying on that point, I want to find out from you in terms of expansion, because currently you're running the facility right here.
Yeah.
And how can people come to the facility? What do they need to come to the facility? And what times are you open currently?
So it's very easy to come to our facility. We accept all sorts of patients, those that are cash payers, those that have insurance. Every single insurance company is acceptable at the Nakawa Specialty Center. So anybody with a medical insurance card, anybody that doesn't have insurance, you can always come in and pay.
All insurance covers are
all
acceptable
insurance
right now?
companies are accessible, they are acceptable with at Nakawa. And then also those that are paying cash, we still accept them.
Okay.
Yeah.
Then inpatient has to wait after the hospital.
Inpatient is going to be in the hospital.
Okay. All right. The other thing that we also want to find out from you, what has been the support of the Ugandan government in ensuring that this establishment is standing and being launched?
Massive support that we have received from the government, and we owe it to them. The government of Uganda was very, very gracious enough to give us this land where we stand today. Through the guidance of His Excellency President Yoweri Museveni, he donated this land. It's a 60-acre property right in the middle of the city, and it is because of his support that we were able to establish what you're seeing today. The government has not only supported us in terms of giving us land, but we have received immense support from different institutes, Cancer Institute, Heart Institute, different hospitals, even in the private sector, because when we were beginning this project, we did quite a lot of consultative meetings. Many hospitals were supported, private and public. So the government of Uganda has created a conducive environment where such things can flourish.
Okay, but that's for now. What would you want the government of Uganda to do for you further so that you can be able to implement all that you have planned out, as you've stated earlier?
What we would expect or what we desire from our government today is exactly what they are already doing, probably to do it faster. The infrastructure in terms of roads, the road network, that will facilitate movements from one part of Uganda to Kampala. Beyond that, we have already seen what they are doing. They've built satellite hospitals in the regions, for example, to take care of cancer. So those are developments that the government has done, big institutions of higher learning to produce more doctors that will be able to work here, more specialists that will be able to work here. So quite much has been done by the government. There's only so much we can demand.
All right, let's talk about the adoption of technology in the work that the Aga Khan University Hospital is going to be doing and is currently doing, really. Are there new technologies that Uganda should be expecting that will ease on diagnostics, on treatments, and the other elements of healthcare?
Oh yes, so much research is happening. Because we are a university hospital, we are supported by the university that is big on research. So there's so much work that is happening in the area of research. not only research in terms of medicine, but also other areas like telecoms. We have courses in the university here that will be equipping people to advance their technology so they can support the healthcare systems across Uganda.
Okay.
Yeah.
There's also a new trend, Diana, that we're seeing, telemedicine. Recently I had a health scare and I didn't need to move from my house to the hospital. I just made a phone call and the hospital came to me. So in terms of telemedicine innovations and advancements, where does the university hospital stand?
We went into telehealth. I think most of us went into telehealth in 2020, courtesy of COVID. Yes. Everybody didn't want to move from home. So during COVID time, we started our telehealth platforms. And yes, we receive patients on those platforms. Anybody that needs to get a service from us, we have the options available. Patients call in, they get assistance, they get their labs done from home. So we actually pick samples from home, come and run them in the labs, and then we give you results by email. Yeah, we do mobile pharmacy, we deliver your drugs to your home. Our specialists are available for a teleconference. So that's happening. In fact, even with radiology, we have gone into teleradiology.
Really?
Yes, we will take your images and then we were able to discuss our images between ourselves, Aga Khan Nairobi, and many of our partners. Yeah, so it's a developing field, and the future of healthcare is there.
It's a developing field, and we are waiting to. How can people actually access the telehealthcare services that you have?
Our lines, our contacts are available on our website and in many of our platforms. We have our contacts laid out there, our emails are out there. So people do reach us through those. Those that have concerns and we can sort them remotely, we get done. But if you have to come to us, we will still encourage and advise you to see your doctor if need be.
All right, as we close this discussion with you, I know that you have to be in so many places at the same time. What's your call to action and commitment, especially as far as the healthcare improvement for Uganda is concerned?
Our commitment, our call for action is very, very simple. And we would like to pass this appeal actually to all Ugandans to begin trusting Uganda. So much has been done by the government, so much has been done by the existing stakeholders, and so much is being done today. Our challenge is we have doubts in our system, yet there is so much that is unpraised currently in Uganda. So we'd like to encourage Ugandans to trust the systems, because much of what you see here is probably what is out there. The only difference is that it's your doctors, Ugandan doctors, offering the same service abroad. So we hope to see an improvement.
When will the hospital be operational?
We have to run 2 years from the moment we do the groundbreaking tomorrow. We are giving ourselves a space of 2 years if everything goes as planned. 2 years' time, we should be able to do something.
Okay, that is Diana Sewanjana, who's the Senior Manager Business Development as well as Operations here at the Aga Khan University Hospitals with an S, Uganda. Thank you so much for giving us your time.
Thank you.
Nakawa is our location as we continue to oversee the launch of the Aga Khan University Uganda campus launch. And we're so delighted to be here. Next to me is a gentleman who I have tried to get us told to us. But he is Associate Vice Provost, Aga Khan University Uganda Campus School of Nursing and Midwifery. Hello.
Yes, hello.
How are you?
Fine, how are you? I'm
I've
excited.
tried to get told to you, but you're taller than me. But
It's okay, we shall manage to accommodate each other.
All right, Dr. Joseph, tell us more about yourself.
Yes, thank you. I'm Joseph Museveni. I have the privilege of serving as the Associate Vice Provost for Aga Khan University in Uganda. We have a School of Nursing and Midwifery. The university has grand plans and will be opening newer schools now that we have moved to our new home, and I know later we shall be talking about that.
Okay, speaking of new home, congratulations.
Thank you.
We have been hearing of that campus, in Old Kampala, Gaddafi Road,
yes.
And I'm so happy that you've finally gotten your own home.
Yes.
But I know that it's also been a journey.
Yes.
Talk to us about that journey, Dr. Joseph.
Oh yes, thank you. Aga Khan University came in Uganda in the year 2000. And they had an accreditation then that allowed us to be able to enroll students the following year. We started with about 8 students, and fast forward, we now have about 300 students. That journey has produced opportunities and challenges, and part of the challenges was to expand and overgrow our space needs in the old campus. And the university has graciously worked around to provide a new facility, purpose-built university here in Nakawa, where we have a larger space and larger fantastic facilities, well equipped, and I know that later we shall be talking about them.
Okay.
The facilities are really nice, and we are grateful for that journey.
Let me tell you, this is the most magnificent building in Nakawa Division today as we speak, and I know that it's going to stay that way for quite a while because you're still expanding.
Yes.
But let's talk about the current structure that is sitting upon which we're standing today, and how many people or students is it intending to accommodate, and then what are the offerings that you are having on board? I know that there's also expansion in what you're going to be offering moving forward.
Yes, thank you. The current offering and the student enrollment is about 300 students spread over our 3 programs, the diploma in nursing, a degree in midwifery, and a degree in nursing. And just at the end of this month, we shall also be launching another degree in nursing. The degree in nursing is a 4-year Bachelor of Nursing Science program that we are launching at the end of this year, and to also bring to our student body a different niche of students. We are looking at high schoolers who have finished their I6 and looking to do a career in nursing. And that program begins at the end of this year and will bring our enrollment to slightly over 300. Yes.
Okay, when we look at the training and workforce development, Uganda's doctor-to-patient ratio is standing right now at 1 doctor per every 25,000 Bana Uganda. And we're talking about nurses and midwives. This density is far below the World Health Organization's target. How is the Aga Khan University Uganda campus going to strategically have training programs that are going to bridge this gap?
Thank you. As Aga Khan University, we are privileged to be supporting the production of health workforces, and we are looking at nurses and midwives, and I know in the very near future we shall also be looking at doctors at both undergraduate and graduate levels. Just a quick one, we will also be launching the construction of the Aga Khan Hospital, which will also be a fantastic training ground for our doctors when that program starts. As a School of Nursing and Midwifery and as Aga Khan University in Uganda, we are really privileged to be already producing nurses and midwives that are able to join the healthcare workforce. Currently, our alumni population is slightly over 1,500, and that is nurses and midwives that we have produced and have contributed to that workforce. I know that the future is still looking tall. The requirement for health workers is still high, and I know that we are below the density requirements for our region.
Yeah.
But we work together with other institutions, and I know that in the near future we shall continue to close that gap.
Okay.
And hopefully we pray that we shall be able to close it very
Now,
soon.
speaking of bridging that particular gap, moving forward now that you have your own campus, your own facilities, how do you intend to then multiply what you've been offering currently and the number of intakes and student intakes that you've been having in order to bridge that gap?
Thank you. With the old campus, we had about 250 students. Going forward with such a big space, we are planning to grow. This year we are launching a new program which will be able to take on new 50 students every year. It's a 4-year program, and soon we'll bring our enrollment to about 500. And a number of other schools that are within East Africa for Aga Khan University that look at health programs are also going to join us. And with those schools together, we should be able to push our enrollment to close to 750 students every year.
Dr. Joseph, that's on the side of the students, but you know there's also the case of staffing,
Yes.
because you can't still have the same number of staff
Yes.
to take care of the 500 to 800 enrollments that you're talking about. So on the side of staffing, how are you actually ensuring that it balances the vote?
Yes, growth of academic programs also comes with growth of our faculty. We have our professors that have been taking care of the current student population. We are planning to grow that space. We are looking at growing that space to about 100 faculty members. We have standards in higher education that give us guidance on student-professor ratios, and we are carefully taking care of that growth, both the teaching staff and the non-teaching staff, that ensure that we support the learning environment properly. And these people are spread over different areas. There are labs, there are different practical learning sites, there are clinical spaces. So all these people are going to be coming together to ensure that our students have a fantastic learning environment, both physical structures and the human resources.
Okay. Once upon a time, Uganda positioned itself as the hub of education, whichever line of education. And so it begs the question, for the campus that we're having established here in Nakawa today, how are you positioning yourselves to attract enrollment from not just Uganda, not just East Africa, and not just Africa, but the entire globe?
Yes, thank you. The facilities in this place are world class, and we are optimistic that students who may have interest and coming from the region are going to will be able to come to this place. We have provided an environment that is enabling for them. We have accommodation for them as well.
Right here on this
Here on this campus. When it is fully finished, it is going to be about 184 students who will be able to sleep on this campus and be able to take their studies here. But also in the neighborhood, we will be working with the other accommodation facility owners to ensure that if students come from very far, they are able to find a place that they can call home away from home and be able to study without any limitations. We are looking at also accrediting our programs in the region, and we are aware that there are opportunities for that space. Our direct entry degree nursing program is already a program that we are looking to interest for members in the region, and we are optimistic that starting from next year, people from the region will be able to come to this program.
Okay, let's talk about accreditation. As far as the government is concerned, the Ministry of Health is concerned, Ministry of Education and Sports is concerned, where do they stand in as far as recognizing you officially as an education entity to support the mandate, the development plans for Uganda, especially in healthcare?
Yes, thank you. These programs are usually accredited. You may know that we have an institution, a government institution that accredits programs, the Uganda National Council for Higher Education. It does a program accreditation and institution accreditation. They have accredited our facilities, they have permitted our shifting from the old campus to the new campus, and they recognize our graduates. You may also know that the different professions also have additional regulation. The School of Nursing and Midwifery produces nurses and midwives who are professionals that are regulated by a different institute. The Uganda Nurses and Midwives Council is a professional regulator for the profession of nursing and midwifery and does recognize our campus, programs, and students.
Okay. Dr. Joseph, the fees, I'm sure, this place looks very posh.
Yes.
Meaning that my school fees might increase a little bit, right? Is that going to be the case, or are we going to try to maintain it where it has been from the old campus?
Yes, thank you. The ethos of Aga Khan University are that it strives to be an accessible institution. Even with the investment, fantastic investment that has been made, we are not looking to increase the tuition. Tuition is pretty much going to stay the same. In fact, even the students that we have had there have come here on the same tuition. Even the new students are coming on the same tuition. And also beyond that tuition, the university looks at many methods of access that can allow people that are struggling to be able to come to our campus. We have had a financial scholarship scheme or financial assistance scheme that helps those who are struggling to be able to come into our programs. And about 80% of our students have benefited from that scholarship.
All right, so what are the current fees structures or tuition structures that you're going to be having moving forward?
Putting everything together is about 5 million per semester.
Okay.
Yes.
All right. And then the scholarship opportunities that you talked about, how does one actually get to apply? What are the criteria? What are the requirements?
The scholarship opportunities are extended to all our students. So anybody who has become our student.
So it has to be an already enrolled student?
Yes, it's for a already enrolled student. And these are able to apply. We usually send the invitation to everybody who wishes. And for everybody that has applied and states that they have a need for financial assistance usually gets a percentage of the scholarship.
Okay, I also know that the Aga Khan University, Kampala campus or Uganda campus is positioning themselves to be a hub of research. What are your research priorities vis-a-vis what the needs are, especially courtesy of the Ministry of Health? We have malaria's prevalency being high, HIV and AIDS. We have non-communicable diseases on the rise. And so I want to find out from you, how are you going to position yourselves in order to contribute to ending some of these conditions, ailments and diseases in Uganda?
Yes, thank you. I know that our Directorate of Research has been working very hard. We have our research priorities, and one that is in tandem with our disease burden in Uganda is the non-communicable diseases. And I know that we have a number of researchers that are working in that area, looking at diabetes, hypertension, cancer, and a number of other non-communicable diseases. And I know that there have been various projects that have led to good knowledge production that is able to guide our practitioners on how to engage.
Let's talk about something else that is quite unique for the facility that you have here. You're focusing on nursing and midwifery, and I know that there's high demand for this particular two in the public sector as far as healthcare is concerned. But at the same time, you don't want to look as if you're competing with the government for churning out these professionals. So it begs the question: what is the nature of collaboration that you're positioning yourself into so that you are complementing the public demand that there is for nurses and midwives versus it being a competition?
The Aga Khan University, even from inception, when the Chancellor launched it, the university did not come into the space of competition. This university has always looked at an opportunity to complement the efforts of government and other key stakeholders that have been producing graduates in different areas. And as you can imagine, for the last 25 years, the university has stayed its course on nursing and midwifery. I know that in the wider space within the East Africa region, we also have investments into medical education, into teacher education, into journalism education, and these are the core professional areas that the university has chosen to go into as guided by the Chancellor. I know that there could have been opportunities for us to go into other areas, but want to stay focused in those areas because that is where the university sees a need to support. Thank you.
Okay, let's talk about long-term plans, 10 to 15 years from today. How is the Aga Khan University Uganda campus, also the hospital, positioning themselves in shaping a holistic healthcare ecosystem for Uganda?
Thank you. Looking forward, the university has grand plans. We have a 50-year plan for this place. There are a number of developments that are going to happen. We just launched the facilities here, but there are a number of facilities that are going to come. Today we're also going to be celebrating the commencement of construction of the Aga Khan University Teaching Hospital in Uganda here at Nakawa. Looking forward, fast forward, this hospital is going to grow into a number of phases to be able to reach a maximum where they're able to look at the in-service, outpatient services and in-service patients, looking at infectious diseases, looking at non-communicable diseases, looking at primary health care initiatives, and a number of other things. But also the schools that we have in the East Africa region, the Graduate School of Media and Communication, the Institute of Education Development, and the Medical College will eventually also extend their services to Ugandans in this place. So we shall be looking at an opportunity where we have a hospital that is able to receive the human resources from its schools, both nurses and doctors and the other professionals as well.
Okay. Now, as one who is at the heart of this particular day, the launch, what is your call to action? What's your commitment to Ghana, Uganda? And also, I want you to speak into community engagement, because many a times you're sitting on a 60-acre, you have good facilities, and to the outsider, it might feel like they're not welcome in because of the beautification of the space, but yet you are offering services that are important to them.
Yes, thank you. This place is not a closed space. We look at it as a public space, and our viewers and people who have a need to come to these spaces are welcome. We have a medical facility. The facility is open. We consider it as a public space. People can walk in, can drive in, ride in, and come and use those spaces. We have academic facilities. Students come here. There are some who are resident. There are some who are staying outside. I mean, we look at this space as a facility for Ugandans. And we feel privileged to be able to represent the institution to our Ugandan population, and we look forward to them coming and making use of our services.
I don't know when I'm next going to see you, Dr. Joseph, but Akatarekeka, you talked about senior six leavers being attracted into the system right away. What are the criteria and qualifications you're going to base on to actually adopt them into the services, the education services you're offering?
Yes, thank you. The A6 niche program is one that we are launching end of this month. These people have already gone through our admission requirements. We usually take the normal requirements as advertised in the program, and these are the standard programs looking at biology, chemistry, physics and mathematics, but key biology as the essential subjects. We process them through our admission requirements. There are some admission assessments that we do, but these are things that I know that A6 leavers will be privy to, and these are not difficult for them to meet. So we look forward to engaging with them, and the space is open for them.
Dr. Joseph, it's been a pleasure talking to you, and he has also given us insight into the expansion, not just as a facility, the Aga Khan University Kampala, Uganda campus, but also the expansion that is going to be happening as far as the curriculums are concerned, the staffing is concerned, the enrollment is concerned, and all the other programs that they intend to adopt with this new space that they have gotten here in Nakawa. So you're welcome to go to the social media platforms and get more information on how you can enroll for the nursing and midwifery education services that they are offering. So before me are some books in the background. I'm holding a huge textbook. And I don't know how I would have been able to ban this if I was a medical student. So really, kudos, and we do respect the medical fraternity in Uganda and in the entire world, because acquisition of all this knowledge into our brains is something else that we have to actually commend these men and women at the forefront of the healthcare system in Uganda. It's called Medical Surgical Nursing, 14th edition in the international editions that it has. It covers subject matters or units from biophysical and biosocial concepts in nursing practice, concepts and challenges in patient management, among other things like gas exchange and respiratory function. I know. All right. Now, you might be asking yourself, why am I holding such a big book and why am I in this room? Well, this is the library of the Aga Khan University Uganda campus. And we're going to be talking to the librarian in charge of it and letting us know what is its contribution. Where does it stand in all the things that we are talking about regarding Aga Khan University Uganda campus? They do offer educational services in nursing and midwifery, and they've done so for a really long time, decades and counting. But at the heart of it all is the library, the source of information, resources, contributing to research, contributing to practices, and contributing to technology. So when we're talking about the healthcare transformation in Uganda, we must not only paint pictures for hospitals, doctors, medicines, technologies, and the list goes, but we also must look into the heart of these education centers, the heart being the library, being the engine that drives access to knowledge, it drives support researching, and also trains a student in evidence-based practices. And of course, the advancements that keep evolving, especially in the medical field. Now, we are joined by Dr. Sarah Nakaziba.
Yes.
Hello.
Hello.
First of all, let me say you have such a beautiful space in which you are, contributing to the education sector in Aga Khan University Uganda campus.
Thank you so much. Yes, indeed, it's a very beautiful space.
Okay. So you have been here since 2008.
Yes.
You came in as an assistant librarian, and today, go munene munene.
No, actually, I came in as a library assistant. It is the lowest in librarianship.
Okay.
Then along the way, by then I had a diploma. Then I went back to school. I did my bachelor's. And I was promoted to assistant librarian. Then I had to go back still to school Of course, with the sponsorship of Aga Khan University, I did my master's. Then there I was promoted again to assistant librarian. Did I say that?
Yeah.
Yeah, assistant librarian after getting my bachelor's. Then I went back for my master's. After that, then they still gave me another scholarship to do my PhD. So after my PhD, I was promoted to the librarian.
It's been a journey for you, I know.
Yes, it's been a journey for me.
What has that journey looked like? What have been, of course, you've talked about the education opportunities you've gotten. What are the other opportunities that have come your way? And also, what are the opportunities that have come the way of the students that have engaged with the university library?
I would say Aga Khan University has been a very good place to work with. It still is, otherwise I would not have been there for all these years, because it wasn't my first place of work, no. But along the way, I would say first of all, it is the leadership. They emphasize capacity development, and I'm one person who believes that you should not stay in one position, understand? I am one person who believes that as human beings, we have to have that crave to always want to acquire more and more knowledge. And that has been very possible here at Aga Khan University. So regarding capacity development, first of all, they also are able to give you scholarships, like they've given scholarships to the different faculty, the different staff, to be able to upgrade. And also the beauty is when you upgrade, there is that provision or an opportunity for you to be promoted at Aga Khan University. So for the students, I must say, when I just joined Aga Khan University, over the years I've learned that it is it is the best library that we have in nursing, with nursing and midwifery collection. It has always been said, we've always received comments that it is the best. But now, of course, we are moving away from Sonam. Sonam is School of Nursing and Midwifery. It has now become Aga Khan University, because more courses are going to be, adopted. So the library has to expand to be able to, to serve the other departments that are coming along.
Okay.
So for the students, I might say that they've gained so much because the library has a number of resources, as I've said. We are being, told that it is the best that we have. And it's not just about the print, but we also go electronic, because our print is supplemented by the electronic resources, and these are books. Currently, we have a collection of 5,700 print. Those are the physical books, like the one you're carrying right now, you're holding right now. And they are being supplemented with over 400,000 electronic books and other electronic resources. But also the university, what it has done, it has made it possible for our students, because they are on the work study program, they're only here for just 2 days. So it has made it possible for them to be able to access these electronic resources. Because remember, there are subscriptions. Ideally, someone is supposed to access them within campus. But the university has gone ahead to procure procure remote access service, and that is we are calling it Open Athens, for them to be able to access these resources wherever they are, in the comfort of their homes, their places of work, or even on a bus traveling to their homes. Yes.
Okay. You have talked about resource acquisition, and I know that this is a field that is constantly evolving. What was making sense today has been upgraded between now and the next 48 hours. And so that means that you thrive a lot on current information. So as a library, how are you positioning yourselves to ensure that your students, the faculties, and even partners in the health care system are getting real-time access to information, and they are getting global medical knowledge that is to the latest advancements that we see in the sector?
Thank you. Actually, the library has a budget, an annual budget for buying books, and also for the subscriptions. So every year, what we do, we reach out to our clients, and these are the faculty members. They always help in the acquisition of the latest books that will guide, or that will help them in their teaching. And also, other than the print, we also look out for the electronic resources that are trending. Yes, we have quite a number of electronic resources. These include the journal articles, the electronic books, as I mentioned, the notes, electronic notes, and then we also have acquisitions for the audio-visual resources. Yes. Now, the library is also a member of what we call the Consortium of Uganda University Libraries. It's called COOL, its acronym. And through that, we are still able to acquire electronic resources and other online resources to aid our students and our faculty in their teaching and their learning. So the library is really trying hard to fulfill its mandate, core mandate, which is supporting teaching, learning, and research.
Okay, you've talked about your engagement with COOL, being a subscriber to that consortium. However, I know that you could probably also be having other partnerships that you're having globally in order to have a vast wealth of resources available to the students here.
Okay. And now, this library that you're seeing here, the Aga Khan University Library, it is part of the Aga Khan University Global Network of Libraries. It is just part of it. Aga Khan, the global Aga Khan has libraries in different countries, in Pakistan, in the UK, in Kenya, and in Tanzania. And because we are part of that global network, you find that some of the resources that we subscribe to are shared across all these different campuses. And it's not just only the online information resources, but also even the staff, the library staff. Because you may find right now here, our colleagues, the librarians that we have here, you find that sorry about that. Okay. The students and faculty here at Aga Khan Uganda campus are not only served by the librarians in Uganda, they are still served by librarians from other campuses. Like, for example, we have what we call an online chat, which is the 24/7. So anyone can go on the chat and send their query, and their query can be picked up by anyone, not only Aga Khan University Uganda campus staff. Yes.
The global network.
Yes, so because we are part of that global network, we share the human resources and some of the electronic resources. And when it comes to the trainings, we still participate in the same trainings to build the capacities of the librarians here.
Okay. Yeah. Well, many Ugandan universities are actually relying on, physical libraries to run information and give it access to the students that they are servicing. But in the case of the Aga Khan Library, University Library, let's talk about the innovations that are coming through or are presently, especially as far as digitization is concerned and having e-library systems. Have you adopted any right now, and how functional have they been in ensuring that there's fast acquisition of knowledge?
Now, the students that we are having these days, they're calling them the Gen Z. For some reason, they are moving away from the print, which some people are still failing to. You're still even complaining about.
That we buy in Kampala today, within 5 days,
it's torn. Yeah. So like when they come in and they look at the medical surgical book, as big as it is, like, come on, people, don't you have it in soft copy? So they come in here to see what we have, and at the end of the day, they come to your desk and ask, can I have this in soft copy? Because they prefer to print. So the university has really put in a lot to make sure that our students have access to these electronic resources. So we have different electronic libraries because we do subscribe to a number of online platforms, not even just one. Yes, some are subscriptions and others we get them on perpetual, meaning that we own them. So someone can download a book and they take it home.
All right.
Yes.
With the global network, what other services and opportunities come with you being a subscriber of the global network of the Aga Khan University, so that the students here in Uganda can be able to attain resources across the globe?
You need to repeat that one.
Okay, today.
But I wanted to still explain more. You wanted to know more of the technology, right? Okay.
Still looking at technological advancements, what other technologies have you adopted in ensuring that you cater to the modified students that you have today?
Yeah, like I mentioned at the beginning, our students are only on campus for 2 days. So even with all those resources, of which most of them are subscription, they can access it within the IP ranges of the university. When they go off, they cannot. So the university is subscribing to Open Athens. It's a remote access service for them to be able to continuously access these resources, as I mentioned, off campus, yes. But also more to that, we have different online platforms. Like we have the LibGuides. LibGuides are like online reference, they offer online reference services, whereby someone goes on the LibGuide platform. You can be able to, maybe if you're interested in a given subject, you'll be able to get to know all the different books, print books on that collection, the online books on that subject, the different online resources. So we have access. We have implemented LibGuides. We have also implemented what we call the discovery service. It is we call it EBSCO Discovery Service, whereby our students are able to access all the resources that we subscribe to across all the resources on one platform. So that one in a way, it eases access to the resources. But now in this new library in the university, which is being launched today, we have implemented a new system. It is called the RFID, Radio Frequency Identification Machine, which is coming with a security gate and also a self-check machine. So meaning that the security of our resources is guaranteed, because someone now cannot go out with a book. As you can see, the library is really, really huge.
So you're meaning Naroga can't pick up this book and walk out of that door?
No, you can't walk out because we have a security gate.
Right.
Yes, so you can't pick and go. So all our students now, when you look at their IDs, they have a barcode at the end. So they just come to the machine, swipe it, put a number of books that they want to borrow, and then it checks it out.
Okay. How does that relate with the e-resources?
Now that one is for the print.
Yeah.
Yes, so it is not related to the E.
Okay. All right, let's talk about the library supporting research here at the University of Uganda campus that we're having. You do have Uganda facing major health challenges. Over 1.3 million people are living with HIV today, and we want it to have 0 infections by 2030. That means that research has to be adopted between now and then to ensure that that vision is attained on a national level. 12 million malaria cases annually reported under the Ministry of Health statistics reports. And those are things that we need to focus on, have research focused on those areas in order to eradicate some of these diseases, non-communicable diseases, to mention but a few. It begs the question, how is the library positioning itself and curating its resources and tools to support researchers at this education center to ensure that they contribute to tackling these problems?
Yes, the Aga Khan University Library has really positioned itself because it is one of our core mandates to support research. So how have we supported, or how are we supporting research? One is by making sure that the capacity of the staff who work within the library has been enhanced, and it is continuously being enhanced. The librarians are continuously engaging in the different trainings because, like you said, everything is evolving. Everything is evolving. If you stay in one place, you're missing out. So the librarians have continuously and are continuously attending these trainings so that they can get the knowledge, the skills to be able to support the staff and the researchers and the students, not forgetting the students. So other than the staff being in position to support research, we also have acquired the resources, up-to-date resources. Like I mentioned, we have a budget every year. So every year we make sure that we have these resources to be able to, so that we are able to facilitate the researchers and the faculty in their research endeavors. The other thing is that the librarians are also involved in the supervision of the students. Yes, students at the university have to engage in research for them to be able to attain their degrees. Yeah, so the staff are also engaged in supervision of the students.
Right. You did mention research, supporting research being one of your core mandates as a library here. What are the other mandates that you do have to ensure that there's holistic attainment of education through nursing and midwifery?
The other core mandate is teaching. Of course, we support teaching. in different ways. Ourselves, we also engage in teaching, but other than that, we support the faculty with the resources that they need to teach. And then the other thing is learning. So we support the students in their learning endeavors by giving them the right resources, the up-to-date resources, yes.
Okay.
And like I mentioned, the staff are well equipped. So in the evening, normally you find the students seated around waiting for the librarians to consult them. Yes.
All right. The other issue that entities usually face is the libraries are only accessible for just a particular time of the day. As a Aga Khan University Uganda campus library, how are you intending to ensure that, especially the print resources, are accessible as and when the student needs it?
One, yes, the library opens from Monday to Saturday, from around 7:30, though the official time is 8, but we open at 7:30 up to 8 p.m. Yes. Now, what happens is we allow our students to borrow more than 5 books, okay, for 2 weeks. So in case if you want to use a book and the library is closed, but at least you have access to the books, they can borrow them and be with them for 14 days. Yes. And then the other thing is that I talked about we have the online, the e-library. So even if they don't have access to the print, they can access the electronic library. Yes.
Speaking of which, you talked about the Gen Zs and how their preference is to, the soft copies, but the hard copies must also remain in business.
Yes.
How are you managing that to ensure that the uptake for library resources is catering for both print and e-systems?
Yes, as much as we're talking about the Gen Zs, but we also have the faculty, because this library does not only serve the students. So most of the faculty prefer the print. And what we have done, we've reached out to the faculty. We've made them our partners. So the faculty, when a student hears a word from the faculty, it makes more sense more than the librarian. Because if they say that, now I want you to read from medical surgical textbook, go to chapter A and B. Definitely they will come to the library to borrow that book or to look at that book, yes. So the faculty have been our partners in this.
Okay. There's also something else that I want to find out from you. You have said this is the best library as far as nursing and midwifery is concerned in Uganda. So that means that the other people that are non-students or not enrolled with the campus here, but would like to access this information, these resources, is there a provision for such an arrangement? Okay.
That will be hard for me to bring me problems.
Okay.
But I can talk about maybe the spaces. You allow me to talk about the spaces, the uniqueness of the library, maybe.
All right, Dr. Sarah, you have a whole 6th floor to yourself. This is too much space. This is the biggest space I've ever seen for any library in Uganda. And so I want to have a better understanding of what is the importance of all these spaces and how are they contributing to your services in the library here.
Okay. Now, this library was designed in such a way that they thought about the user's needs, the different users' needs. Research has been carried out regarding the user's needs, regarding information acquisition. And I'm happy to report that the library, the Aga Khan University Library, has implemented the research findings. When you look at the spaces, I think this makes it stand out, because we have 3 kinds of spaces. We have the indoor space, like where we are seated right now, where we are right now. Then we have the semi-outdoor, out there, in the corridor or the atrium. And then we have the outdoor.
Really?
Yes, the outdoor spaces. So the outdoor spaces, we are calling them the knowledge gardens. I think it is the biggest spaces that we have. And the time that we have been here, you find that it is the most favorite place for our students.
Reading a book in nature, Dr. Sarah, is unmatchable.
I know, the plants, the breeze, especially in the evening, yes. And also because of that space, they are allowed to come in with a drink. They can come in with a cup of tea. They can come with a cup of coffee and also a light snack. So that flexibility, they really love the space. So for those who want to sit outside and they don't mind some little noise, They are really, really having fun in the outdoor spaces. Then we have the semi-outdoor for those people who are not very sure, do I want the inside or do I want the outside? So they're also enjoying that space around the corridor. Now in this space, it is mostly for collaborative learning. You find that the faculty come in with their students, especially the research students. So they sit there and then he or she guides them, because right now, in fact, this semester is for research. So you will find them seated in the evening with their faculty. But also, again, in that space, you find that the students also consult the librarians still around that space, and even amongst themselves. Now, the indoor space, it is for those students who want quiet, they don't want so much noise, but still, all these spaces were designed in such a way that they enhance collaborative learning. In fact, when you look at the setup of our furniture, you find that it is for collaborative learning. And also we have what we call the group study rooms. I think we have 5 of them right now, for those who want to study in groups, those who want to have online meeting with their faculty, with their supervisors, yes.
Okay. All right, as we close this conversation, let's talk about the future vision of the Aga Khan University Uganda campus library. How are you positioning yourselves, not to just be at the center of books and resources, both digital as well as print, but also being a knowledge hub that is supportive of research, supportive of innovation, supportive of the healthcare transformation that we envision for Uganda futuristically?
Thank you. When you look at our new, our strategic plan for the next 5 years, we have a number of things that have been stipulated in there, and really digital comes out very strongly, and evidence-based synthesis also comes out very strongly. So the plan is to continuously build the capacity of the librarians to be able to implement evidence synthesis within the library and the university. We need to be able to assist or to guide our faculty and researchers as they engaged in the different evidence-based research. Now, when it comes to being a center of excellence, for now, you realize that ever since we opened, we have been receiving several requests to come and benchmark with us. Several have been coming, only that we have been slow because we had not yet launched. But of course, we plan to live up to that standard, because we are at that standard where everyone is like, wow, Aga Khan University. So we plan to try and live to that standard, where we should be the center of excellence, where we should be that place where everyone wants to go and benchmark. For the technology, Aga Khan University believes in continuously advancing the technological implementation of all the departments, and the library is not excluded.
Okay, Dr. Sarah, today is the D-Day. We are having the launch of this particular center and also the university groundbreaking. What are your sentiments around that?
For all these years I've been at Aga Khan, I must say that
almost here for 2 decades.
You're making me feel old. So for all these years I've been at Aga Khan University, I must say I am one of those people who are really, really excited and happy, because it is not every day that you get to have such, a huge milestone. It is really huge to us. And when you look at the spaces, when you look at the beauty, when you look at what we have to offer, it is so amazing. We are very grateful to the Aga Khan, His Highness. We are very grateful to the donors. We are very grateful for all the university leadership for this far that we have come.
Okay. All right, congratulations on the journey that has been and the journey that is moving forward. They have told me that there's technology at the door. If I walk out with this book, I will be arrested. Do I get to be arrested? Anyway, it's been a pleasure talking to the senior librarian here at the Aga Khan University Uganda campus. I must say that the innovation adoption in here is quite tremendous, and it is definitely one that can be benchmarked on by other universities that are offering educational services in nursing and midwifery, not just for Uganda, but East Africa and Africa by and large. Now, there's some, as we're rounding up this conversation, this sit down with Dr. Sarah, library is not a luxury, but one of the necessities of life. It's a quote by Henry Ward Beecher. Cutting libraries during a recession is like cutting hospitals during a plague. You understand what that actually means. The library is the temple of learning, and learning has liberated many people than all the wars in history. A quote by Carl T. Rowan. That, simply put, means that the library is at the epitome of the education as far as the services that are being offered here at the University Center are concerned. Without it, there will be less knowledge acquired. We're moving away from, theoreticals. We're moving to competence-based education for us as a country. And this library is positioning themselves to be the education hub, journeying us into that direction.
Okay. Yep.
Okay. So the library has, the Aga Khan University Library has implemented the RFID machine, radio frequency identification machine, which has come with two systems. It has the security gate, like the one that we have just seen, and then it also came with the self-check machine, this one here. Now the students are able to check out the books themselves and also check them in and also renew them by themselves. So how does the checkout work? All the students have IDs like mine with a barcode printed at the back. Now what they do, they just come here, go to checkout if you're going to check out a book. And then they place their ID here.
Place it again.
Okay. So they come here to check out, and then you place your ID here. So you'll be recognized, welcome. And then now you can place your book here, where there is place a book here, the book that you want to borrow. And then you need to verify the ID of the book is here, and the title is here. It's for health research. If this is the book, then you can go ahead and click tap confirm.
Behind every successful man is a woman. But lately that has been edited to say that behind every man is a successful woman. One wonders, which one is it? Mr. Katende, which one is it?
There is also another version to it. Who is the woman?
That's
is it the wife?
Yeah.
Or the mother?
Yeah. All right. Well, behind every successful medical university is a strong academic system ensuring that programs meet international standards and also admissions are inclusive, with students graduating with the skills that Uganda urgently does need. At Aga Khan University, the Uganda campus, we're looking at the responsibility falling to the registrar academics, and that is Mr. Nicholas Katende, who's seated next to me. And he's going to be talking to us about his oversight when it comes to the quality of education, the student affairs, and of course the curriculum implementation. Now, conversations that I've had with other leaders within the vicinity of this center is that there's even introduction of new programs that are upcoming, but nevertheless, let's first start with the basics. Mr. Katende, as the academic registrar, talk to us about the journey that has been for the Aga Khan University Uganda campus.
Thank you very much. I would wish to draw back to where we started from. That is close to 25 years ago, because the university was launched in 2000, which we used to call the millennium, and that was July 14th. Though the official classes started in January 2021, so 2001, with bachelors of nursing and diploma in nursing. Now, we've got quite a lot of programs that came in, because with bachelors of midwifery, that's Bachelor of Nursing in Midwifery, which started in 2016, and we're filling up the gap that already exists within the market. Now, the programs we offer are basically for extension. Because when you look at the background of programs in nursing in Uganda, majority of the students who are dropping out from senior 4 and start certificate in nursing. So they float, they just hang around. They don't know what to do next. So with the diploma in nursing as an extension program, it allows the students with a certificate to upgrade. Then also with bachelor's in nursing, it allows the students to upgrade from the diploma to the bachelor's. And the same applies to Bachelor of Science in Midwife, which is also an extension program. Now, Aga Khan, which is slightly different from the others, our diploma program is for 2 years. I know other institutions or other schools of nurses, their diploma is for 1 year and a half, because they are basically looking at the UNIMEB governed curriculum. Now, with UNIMEB, yes, it fits within 3 semesters or 1 year and a half, but with Aga Khan being an international institution, and we had an international curriculum before we came on board doing courses under the UNIMEB, we didn't want to lose our international look. And there are courses that are not part of the UNIMEB that are integrated in 1 semester of Aga Khan. So this one helps to nurture the student and also groom the students. By the time they start doing the UNIMEB courses, they already have an advantage, because we have a very good pass rate. Because though we are waiting for the results of this, the exams were done in June, but from the previous results, we've not got anything below 97% pass rate.
Excellent.
So that is attributed to the fact that these students get exposed and get nurtured into the program within that 1 semester of Aga Khan.
Okay. Mr. Katende, churning out excellency at the end of programs is one thing, but I know that that's not where it starts from.
Yeah.
It starts from the admission of the students. Talk to us about the admission policy that you have here that then in tandem does contribute to the excellence that you churn out to the industry.
Now, Aga Khan has a very good and all-inclusive policy in admissions. One, for the diploma, we always look at one, if you have at least 2 years experience, you have a certificate of enrollment, and you have a practicing license. Those are coming from the Uganda Midwife Council, because that is a mandate by the regulator. Now, when you come in, it's a free and fair system, open access. Every student from any walk of life can be able to join, but there are interviews that we put in place just to filter and make sure that we have the right candidates who are fit, both written and oral interviews, just to assess the student's capability. Now, for the bachelors, it's also, now we have 2 versions. There are those students who come straight from senior 6 to diploma and then bachelors. Now, those ones will require 2 years experience with a certificate of registration and the practicing license. Now, there are those who started from senior 4 certificate, diploma, now they want bachelors. Now, those ones, based on the recent adjustment by the national, in fact, by Uganda Midwife Council, they waived off the 2 years from those ones of experience. So it is just the senior 4 results that we look at, where you need to have the principal passes or passes in physics, chemistry, biology, and for biology and English, you need to have a credit. Now, that allows them to join and be able to at least excel and upgrade their classes. Now, to make this more accommodative to people who are working, because this is what we call a work-study program, meaning that they study for 2 days.
You apply.
Because they're already in the field. We are already looking at practicing nurses or practicing midwives. So they basically have 2 days study within the week, depending on the timetable arrangement. So they can do Monday, Tuesday, or Wednesday, Thursday, but currently we are having Friday and Saturday. So they can help this person who is at work to not to lose his or her job, because he needs the money to fund his education or higher education. So by leaving or getting more work days, it helps them to retain their work, to retain their jobs. But also it helps them to learn, and within the 2 years for the diploma or the 2 years and a half for the bachelors, they are out there to compete favorable to any other.
Well, it's what they call learning on job, and that's
Exactly.
a very good way to train. So let's talk about the designs, the curriculum designs that you have, and how they are actually adoptive of competence-based learning. You do have interrelational kind of learnings that have to be integrated into the curriculums that you currently have. So talk to us about the designs or the evolution of the curriculum designs to meet the current medical needs and standards, not just for Uganda, but also for the global market. Because I know you've churned out, people and students or nurses and midwives to the global market.
Thanks for that question. One, the way the curriculum is designed is looking at the kind of customers we are attracting. We're already attracting practicing nurses and practicing midwives. So one of the things that we actually embed in are what we call clinicals, because these are classes that are done straight in hospitals. So they have time to study theories in class, but they go and implement what they've learned in the real world. Yes, this is a diploma student who might not have the information that is relevant for a bachelor's. So they also design the curriculum to fit within that. In fact, I could proudly say that Aga Khan was the first university in Uganda to start a work-study program or a work-study curriculum. In fact, we always had issues with National Council and Uganda Midwife Council, because they were asking, how do you teach for 2 days and yet other schools of nurses are teaching the same for a whole week? So the way it is designed that when the students are at work, they are learning. When we go for clinicals, we are also advancing the same. So it gives them that environment that we can achieve both academic and work. Now, the way the curriculums are designed, they're in a way that we capture the recent changes within the medical world. That's why we always do reviews of the curriculum. In fact, the last review that was approved by the National Council, that was last year in July. In fact, it was July 14th. Now, we got the new approvals for the next 5 to 6 years. That is for the diploma and for the bachelor's. Now, that helps us to have or teach students with the more recent information that is on the market. It is one thing having a nurse who doesn't even know that there is a new medicine on the market or there is a new disease just because it was not documented. So we make sure that we revise our curriculum and provide the best to the students that makes them compete. Now, I have got quite a number of students who have applied for jobs abroad and also to further their studies abroad. The best that we do is to actually fill the forms by the different verification teams. We indicate the clinical hours they've done and the theory hours, and I could say that none has been rejected. So they are able to fit into anywhere they go into, whether it is in America, whether it's Canada, whether it's UK, anywhere they go, they can easily fit in. So that helps us, because our curriculum is designed as an international curriculum, looking at the needs of the international and the local.
Okay. All right. So this new education center is coming with new additions, especially for you as a academic registrar. You're having new programs that you're introducing. Talk to us about these programs.
First, we are blessed that by the time we entered here, we had already got the approval for a program that is Bachelor of Nursing Science for direct entry. Aga Khan for the last close to 25 years has been known as a university teaching extension students or upgrading students. But for the first time, we are now also attracting the direct entry, someone coming straight from senior 6. As long as you have a principal pass in biology and any other principal pass in chemistry, physics, or math, meaning that you can actually join and study. So we've just closed our admission for that program, and they'll be starting their courses in the first week of October. Now, that is one program that is already on board, and we started when you're already here. Now, there are other programs that are being brought on board, and hopefully by next year we shall be able to have the approvals from the National Council. That is the masters, because when you go out there, the surveys we've done, we've churned more than 1,500 alumni. And when we go out there, they ask one question. You produced us, but we are stuck. We can't leave what we learned from Aga Khan and get diluted by going to another institution which will not provide the same quality that we had.
So if we can have an upgrade.
So with masters in advanced nursing and masters in advanced midwife, that is clinical, those ones will help now to attract our students back. Those who are stuck at their bachelors, but now they can be able to upgrade and do their masters. Because a number of institutions need leaders, because at master's level you're basically manager, but they have the background. So we shall have that with specializations, because we will have specializations like critical care, oncology, and quite a number of courses that will come in. So that will help them to fit into the world as managers, but in the clinical setting. We've got so many master's programs in other institutions, but ours is going to be slightly unique, looking at our nurses in the field that have leadership skills that can be able to further the health sector.
Okay, all right. Now let's talk about accreditation and standards. National Council of Higher Education, you must subscribe to it. The Council of Nurses and Midwives, Uganda, you must subscribe to it. And of course, the other entities, national bodies that have been positioned to offer supervisory and regulatory authority over the services that you are offering. When it comes to the Aga Khan University Uganda campus, how have you managed to maintain and keep up to standard with the regulatory requirements, the standardizations that are continuously evolving, but also making sure that the courses that you're offering are accredited ever so often?
Thank you very much. Now, Aga Khan, one of the things that I love with Aga Khan is we are a law and a policy abiding institution. There's no shortcut about it. Because with a university that is already having that background or that culture, anyone coming in, you have to follow suit. So we are always under the regulatory authority, consulting on issues that have some gray areas, and National Council is our main regulator. All our programs or curricula that we are developing, they all have to go through the same. The accreditation of the building, the same thing. With the National Council, we already have created a rapport with them that helps us when we submit. They can be able to guide us on what needs to be done, and it's done in time. Now, one thing that we do as a university, because of the quality that we don't only preach, but we also practice, we try to go beyond the limits set out by the national councils or by the regulators. Because just an example, normally the pass mark for a government course that is for bachelors, it is 50. You have a 50, you are good to go. With Aga Khan, 50 is a retake. It has to be 60 and above for you to pass. So we go past the regulator, because what we want is to maintain our class above the minimum. So that has also helped us to churn out students who actually fit and go beyond the norm, because they are trained in that way. When it also comes to the way the curricula are designed, we make sure that, yes, there is the minimum provided by the regulator, but we always have to go beyond what the regulator says. If it's about attendance in class, the regulator talks about 75%. Ours is 85%, because it's not about the paper you get. It's about the knowledge. And you cannot get knowledge by Bluetooth. You have to attend. So we always try to go beyond what the regulators say, so that we keep our students and we keep the university with the quality deliverance and quality students that we churn out.
All right, so I know that you have collaborations with your sister campuses in Kenya and Tanzania, but also the global network. So that means that when it comes to accreditation and standards, you must also abide by those other regions and localities. Talk to us about that.
Yes, we do, though normally the way the system is structured in terms of equivalences, we abide by the local regulators, because when they're asking for equivalence, they look at the qualification framework of Uganda and see, do you fit in? If you're above it, that's well and good, but you cannot go below it. So a student who is transferring or is going to do an upgrade in UK, they will automatically look at, do we meet the minimum requirements of the Ugandan Midwife Council as a medical regulator, and the Ugandans, and also the National Council for Education for the education part. And because we already go beyond what the minimum is, then we find ourselves easy to fit in.
Okay.
Now, one of the issues that we might need to factor in, rarely do you have transfer classes for an extension. A reason being that the requirement is you need to be a practicing nurse or a practicing midwife in that country. So if you're a person coming from Nigeria, as an example, from South Africa,
so you can't have a placement program of sorts.
So it requires you to have practiced there, you get an equivalence of the same here, then you can be allowed to study with us. Without that, that becomes a problem. But with the new program coming in for the direct entry, that one, at least the chance of transfers will be very high.
Okay. All right. So we do have the government of Uganda having set up a loans scheme, especially for students uptaking higher education, just so to ease the burden of the cost of education in Uganda. As the Aga Khan University Uganda campus, how are you easing the burden of acquiring the education services that you are offering? Because they're up to date, and that means that you, as a university, are investing in giving them the most recent knowledge bases that are available on the market, locally and globally. But then at the same time, we talked about earlier, got to know that give or take, a student has to part away with 5 million Ugandan shillings per semester. That's a lot of money for a working student.
That is very, very, very true. In fact, one of the biases students have out there, the moment you talk about Aga Khan, they just think of, no, that's a university for the rich. They, without even looking at how much. The perception is Aga Khan is expensive. And when you go out for outreach or for marketing, you actually go and diffuse this tension. Because yes, the 5 million you talk about, but Aga Khan has got what we call financial assistance that is given to all students who apply for it. It might vary depending on the need, because someone who is earning 1 million will not get the same amount like that who is earning 300. Or someone has an ailing parent and one doesn't have any responsibility. So there are some parameters we use when you're giving financial assistance. But you'll find that a student, plainly, who is supposed to get who is supposed to pay 5 million, the university can actually contribute 2 million. And this is not a loan that you're going to pay for after graduating. This is money set aside by the Aga Khan and the donors to make sure that we facilitate these students so they can be able to finish and graduate. Because we are not selling education. We are providing a service to the community, and the service is education. So we want them to excel and get the best. But we also don't want to chase a student from exams. That's why the university provides a flexible payment plan for the remaining balance. So you can be able to create a payment plan that can even continue paying in the holidays.
Post-education acquisition.
So you've studied a semester, you've done the exam, but it allows you to pay even in the holidays to clear that fees, and you can be able to continue next semester without any balance, and you move on nicely, and you can be able to graduate after your 2 years or 2 years and a half. So this financial assistance helps to remove the burden from the students, and they can be able to concentrate. And besides that, also Aga Khan is an institution that helps students by looking at what we call hardship allowances. Because we want you to study without dropping out. But maybe you got an accident and you're unable to raise the money or to continue. And we don't want you to drop out, because we have the highest rate of those who finish. So if we enter as 100 students, we expect at least not less than 95 to finish, unless the others have something totally that the university cannot intervene in. But the university has hardship allowances that they can help such students with need as long as it is legitimate and not something that you've created for yourself just to benefit. But there's that procedure that is in place that helps the students get some money that can help them continue the education irrespective of the problem they might have encountered.
Okay. I know that with your many years in this particular field of academic registrar, you have come across many dynamics as students desire to enroll for such education. What are some of those dynamics, and what solutions have been created by the university in order to address those dynamics?
Thank you. Now, there are two things that I've seen which are more of a stumbling block, and more so to the extension students. But good enough, Aga Khan, through the leadership of the faculty and the leaders of the School of Nursing, we managed to lobby the Uganda Midwife Council to remove the 2 years experience. Because a student who started from senior 4 did certificates for 2 years, went and practiced for 2 years, comes for diploma for 2 years, then you have to work for like 2 years, then you come for bachelor's, which will take 2 years and a half.
10 years.
That's literally 11 years before you can have a bachelor's degree as a nurse. That's too much time, looking at the economy, looking at the dynamics of the society. So we lobbied, and at least the Uganda Midwife Council had our cry, and they removed the 2 years for an extension student who started from certificate. Now, the other one that we are lobbying for is, when I'm registering you for a diploma, I need you to have passes in biology, chemistry, physics, math, and English. But when I'm registering you for bachelor's, that changes. I need at least credit in biology and English. But this student was allowed to register for diploma with a pass in biology and English. But now for her or him to
done
join,
their due diligence, yes.
For them to know to come for bachelor's, they need to convert that pass in biology into a credit. They need to convert that pass in English into a credit in English. Now, the question is, why are we still evaluating students based on their senior
That
4,
system.
and yet they have a certificate and they have a diploma?
That's a very big gap.
So, we stop these students from progressing in life or in their career just because they had a pass in biology and English at senior 4. But the biology they did at senior 4 and the biology that this student has got through their certificate and diploma is way beyond what they studied in senior 4. So why do we need to limit those students and their potential? These are students who are working. Unless when you're telling me that this kid is killing patients, then it does not need to upgrade. But they are in the world, they are in hospitals, but they just need to upgrade their education. And that is a stumbling block for an extension student. So we are lobbying the government to see if they can be able to waive that, so that the minimum entry requirement for a bachelor's holder or for a student who's coming for bachelor's should be a diploma, not senior 4, because that was done when they're coming in for the certificate. We don't need it again when they're coming for bachelor's. So,
all right. So it's been close to 25 years. There's 25 other years that have to be, recognized with the work that you're doing through the academic registration. So it begs the question, what is the vision for the next 25 years?
now, for the next 25 years, one is to maintain and improve on our quality, because as they usually say, quality is a moving target. You can't say you have quality and there's something new that you need to maintain. So the next 25 years, we're looking at maintaining the quality that we have put out there, because that is our reputation, that's our brand as Aga Khan. And the students who come here, they actually attest to it. Because they will tell you, I will not go to any other institution, I won't mention them. And I would prefer, because there are those who are not taking this admission just because we had many students who had applied for the course, and we have limitations as per the regulator, because for bachelors, we have the number that cannot exceed. But we had very many who had applied for it. But someone says, no, I'll wait for next year. I'm not ready to waste my time to go to somewhere else. So we have that brand to keep. And also we expect so many other courses to be brought on board, because we expect College of Medicine to come in, or medical college to come in, that is having bachelors of medicine and surgery, masters of medicine, later on PhD nursing. We also expect School of Graduates, Media and Communication, which will have journalism or master's programs in journalism that will be brought on board. And we expect more and more programs to be brought in. And with the hospital coming in place, we shall not have any problems.
All right, Keka Katale Keka, the hospital coming in place, the groundbreaking launch is upon us and begs what is the futuristic collaboration between the university, Uganda campus, and the Aga Khan Kampala Hospital?
Now, right now what we are doing is all our clinicals are placed in different government hospitals, because we do clinicals in Chirudu, in clinicals in Mulago, clinicals in Kawempe, and so many other places. But when we have our own, then it will be very much easier, because we shall be training our students with our Aga Khan Hospital training school. So we can be able to impact the knowledge we want, because we're in a very easy controlled environment where our students can be given first priority. So that is how the university is going to benefit from the hospital.
Okay. Mr. Katende, congratulations. It's been a pleasure talking to you. You've heard it from the horse's mouth. He is the academic registrar of the Aga Khan University Uganda campus. That is having a new center right here in Nakawa. Congratulations on that front. But also, this means that they are doing things in a bigger and better way, introducing new education services to you, especially those that have been demanding for, higher levels of learning. Well, they're going to be adding that to their basket of curriculum that they are offering here. But at the end of the day, what we're trying to get at is that investment in education, especially health education, is investment in a better healthcare system itself, which in tandem is investment in a better Uganda for you and for me. And so this is the right place to engage in, especially if you're looking to upgrade or even start